Welcome to Steady Balance on Spotify, your space to understand the science behind balance and vertigo.
Hello everyone, I am Dr. Rohan Patel from RV Hospital, Ahmedabad. Today we are going to discuss about vertigo, and in vertigo we'll discuss about peripheral and central vertigo today. So everybody knows about the vertigo. It has basically two types. One is central and one is peripheral. So what is peripheral vertigo basically? So peripheral vertigo means the problem is coming from the inner ear or vestibular nerve and not from the brain. It comprises the 90% of the almost all the vertigo cases. Main disorders which are there in peripheral vertigo are benign positional vertigo, which is called BPPV, Meniere's disease, and vestibular neuritis. In short, whenever you are having peripheral vertigo, the issue starts in the ear and not in the brain or from any other part of the body. And central vertigo usually comes from the brain, especially areas like brainstem and cerebellum, which process balance. So the key difference is peripheral means ear and central means brain. Now, because it helps us understand both risk and urgency, that's why this classification is very important. Peripheral vertigo is more common, more treatable, and usually not life-threatening. For example, BPPV can often be treated with simple repositioning maneuvers and vestibular suppressants. Comparison to peripheral central vertigos are very notorious. They usually do not give good response to vestibular suppressants or exercise. And the conditions which include in central vertigos are vestibular migraine, stroke, ischemia, if you are having less blood supply in your brain, if you are having any tumor inside the brain, all these things can cause central vertigo. Now, let's talk about few types of peripheral vertigo. One I already told, like benign positional vertigo. So, as name suggests, whenever you try to move, you will feel dizziness or vertigo. It's called positional vertigo. There will be a brief spinning episode of few seconds to few minutes, usually triggered by head movement, and lasts seconds to at least minute. In Meniere's disease, there is another type of peripheral vertigo. Episodes usually last a little bit longer, about 20 minutes to an hour, and often associated with hearing loss, tinnitus, ear fullness. Another important variety of peripheral vertigo is vestibular neuritis, in which you will have sudden severe vertigo, which usually lasts few hours to days and often accompanied by the nausea and difficulty walking. So the trigger, duration, and the ear symptoms give important clues. So in contrast to these features, in case of central vertigo, you will have lot other symptoms like double vision, slurred speech, facial weakness, severe headache, numbness of upper and lower limb, weakness of upper and lower limb. So with these symptoms, you can get idea about that there is something wrong with the brain. So which is causing all other symptoms and as well as vertigo. Doctors may use bedside tests like hint exam to differentiate stroke from the inner ear causes in acute dizziness. But for patients, the message is very simple. Vertigo plus neurological symptoms is an acute emergency. You should rush to the hospital. You cannot wait for doctor's appointment. You need to rush to the emergency room. There are a few types of central vertigo. One is vestibular migraine. It is not that alarming or urgent condition, but it will have recurrent dizziness, motion sensitivity, and imbalance. Sometimes headache is also associated with vestibular migraine. Another thing you can have in brain is brain tumors, any kind of swelling inside your skull. It usually causes gradual symptoms like one-sided hearing loss, tinnitus, imbalance. One is vestibular schwannoma, which usually affects vestibular nerve. So these are the types of central vertigo and starts in brain and becomes urgent when neurological symptoms appear. So in short, if you are having brief positional spinning, think of benign positional vertigo. If you are having hearing symptoms, think of inner ear problems. And if you are having any neurological symptoms, either upper limb or lower limb weakness, seek urgent care because that is a sign of central vertigo. So these are the main difference of central and peripheral vertigo. And as a patient, you always need to be focused about your symptoms, that you are having just vertigo or vertigo with other symptoms like peripheral limb and upper limb and lower limb weakness, facial weakness. So it's my pleasure understanding the difference between, to give you about idea about difference between the peripheral and central vertigo. Thank you so much.
A public awareness initiative by Dr. Reddy's. This communication does not substitute advice of a medical practitioner. Please consult your doctor for any medical advice.